Question 1. The risk matrix shows a high likelihood of challenges in fine motor skills and hand use for a child assessed with the Sensory Integration and Praxis Test, SIPT. Considering the SIPT focus on underlying sensory processing and praxis, which of the following approaches best guides the development of an intervention plan to address these fine motor difficulties? Option A. Develop a plan that prioritizes sensory-based strategies directly informed by the SIPT subtests related to somatosensory processing, visual motor integration, and motor planning, and then integrates these with targeted fine motor activities. Option B. Implement a broad range of sensory integration activities without specific linkage to the SIPT subtest results concerning fine motor skills. Option C. Recommend general gross motor activities to improve overall body awareness, assuming this will indirectly benefit fine motor skills. Option D. Focus solely on providing a variety of fine motor exercises and activities without considering the SIPT findings on sensory processing or praxis. Correct answer is A. Develop a plan that prioritizes sensory-based strategies directly informed by the SIPT subtests related to somatosensory processing, visual motor integration, and motor planning, and then integrates these with targeted fine motor activities. Explanation. This scenario is professionally challenging because it requires the clinician to synthesize information from a standardized assessment, SIPT, and translate it into practical interventions that directly address a child's functional limitations in fine motor skills and hand use. The challenge lies in accurately interpreting SIPT subtest scores, understanding their underlying sensory processing and praxis components, and then devising strategies that are both evidence-based and tailored to the individual child's needs, while adhering to professional standards of practice and ethical considerations. The correct approach involves a comprehensive interpretation of the SIPT results, specifically focusing on subtests that directly or indirectly inform fine motor skills and hand use, such as those measuring somatosensory processing, visual motor coordination, and motor planning. This interpretation must then be integrated with direct observations of the child's hand use and fine motor performance in functional contexts. The subsequent intervention plan should be directly informed by these findings, prioritizing strategies that address identified sensory processing deficits or praxis challenges that impede fine motor skills. This approach is ethically and professionally justified as it is grounded in the principles of evidence-based practice, client-centered care, and the professional scope of practice for occupational therapists utilizing standardized assessments. It ensures that interventions are targeted, effective, and directly linked to the assessment data, promoting optimal outcomes for the child. An incorrect approach would be to solely rely on a general understanding of fine motor development without specific reference to the SIPT findings. This fails to leverage the diagnostic information provided by the assessment, potentially leading to interventions that do not address the root cause of the fine motor difficulties. Ethically, this represents a failure to utilize assessment data appropriately and a deviation from evidence-based practice. Another incorrect approach would be to focus on sensory strategies that are not directly linked to the SIPT subtest results related to fine motor skills and hand use. For example, implementing vestibular input strategies without a clear SIPT-based rationale for their impact on hand function would be a misapplication of resources and assessment findings. This is ethically problematic as it may not be the most effective use of the child's time and the therapist's expertise, and it does not demonstrate a clear connection between assessment and intervention as expected in professional practice. A third incorrect approach would be to recommend generic fine motor activities without considering the underlying sensory processing or praxis challenges identified by the SIPT. While fine motor activities are important, without a targeted approach based on the SIPT, they may not address the specific barriers the child faces in developing efficient hand use. This approach lacks the depth of analysis required for effective intervention and may not align with the principles of occupational therapy, which emphasizes understanding the why behind a child's functional limitations. The professional decision-making process for similar situations should involve a systematic approach. 1. Thoroughly review and interpret all relevant SIPT subtest scores, paying close attention to those that inform sensory processing and praxis related to motor skills. 2. Correlate SIPT findings with direct observations of the child's fine motor skills and hand use in functional activities. 3. Develop an intervention plan that directly addresses the identified deficits, prioritizing strategies supported by the SIPT data and occupational therapy principles. 4. Continuously monitor the child's progress and adjust interventions as needed, ensuring ongoing alignment between assessment, intervention, and functional outcomes. Question 2. The evaluation methodology shows that a child presents with specific patterns of sensory processing deficits on the Sensory Integration and Praxis Test (SIPT). How should these SIPT findings be most effectively interpreted in relation to the child's ability to generate adaptive responses? Option A. By broadly stating that the SIPT results indicate general sensory processing difficulties that likely impact all aspects of the child's adaptive responses. Option B. By focusing on the child's motor performance on the SIPT and assuming that improvements in motor skills will automatically lead to better adaptive responses. Option C. By solely reporting the raw scores and standard scores from each SIPT subtest, allowing the parents to infer the functional implications. Option D. By directly correlating specific SIPT subtest scores with observed functional limitations in adaptive responses, explaining the underlying sensory processing challenges that contribute to these limitations. The correct answer is D. By directly correlating specific SIPT subtest scores with observed functional limitations in adaptive responses, explaining the underlying sensory processing challenges that contribute to these limitations. Explanation. This scenario presents a professional challenge because it requires the clinician to interpret complex assessment data (SIPT) and link it to observable functional outcomes, specifically adaptive responses. The challenge lies in moving beyond simply reporting SIPT scores to demonstrating the practical implications of those scores for a child's daily life and participation. This requires a deep understanding of the theoretical underpinnings of sensory integration and the ability to translate abstract sensory processing patterns into concrete functional behaviors. Careful judgment is needed to ensure the interpretation is accurate, evidence-based, and directly informs intervention planning. The correct approach involves a comprehensive analysis that directly connects specific SIPT findings to observed difficulties in generating adaptive responses. This means identifying patterns in the SIPT results, e.g., challenges in vestibular processing, somatosensory discrimination, or praxis, and then articulating how these patterns manifest as difficulties in a child's ability to respond effectively to environmental demands. For example, poor somatosensory discrimination might be linked to difficulties with motor planning for dressing, or vestibular processing challenges might impact a child's ability to maintain balance during play. This approach is ethically sound and professionally responsible as it aligns with the core principles of occupational therapy, which emphasize understanding the relationship between a person's sensory processing, their ability to interact with their environment, and their functional participation. It directly addresses the why behind the observed functional limitations, providing a clear rationale for intervention. An incorrect approach that focuses solely on reporting SIPT scores without linking them to functional outcomes fails to meet professional standards. This approach is deficient because it provides a descriptive, but not explanatory, account of the child's sensory processing, does not demonstrate an understanding of how these sensory patterns impact the child's ability to engage in meaningful activities, which is a cornerstone of occupational therapy practice. Ethically, this approach falls short by not providing a complete picture of the child's needs and the rationale for intervention. Another incorrect approach that oversimplifies the relationship by attributing all functional difficulties directly to a single SIPT subtest score, without considering the interplay of multiple sensory systems or the complexity of praxis, is also professionally unacceptable. This approach lacks the depth of analysis required for accurate interpretation and can lead to misdirected or ineffective interventions. It fails to acknowledge the nuanced nature of sensory integration and its impact on adaptive responses, potentially leading to an incomplete or inaccurate assessment of the child's needs. A professional decision-making process for similar situations should involve a systematic approach. 1. Thoroughly review all SIPT data, identifying significant findings and patterns across different sensory systems and praxis components. 2. Observe and document the child's functional performance in various contexts, noting specific challenges in generating adaptive responses. 3. Synthesize the SIPT findings with the functional observation, actively seeking to establish a clear and logical connection between sensory processing patterns and observed behavioral difficulties. 4. Articulate this relationship in a clear, concise, and clinically meaningful manner, explaining how sensory integration deficits may be contributing to challenges in adaptive responses. 5. Use this integrated understanding to inform the development of targeted and evidence-based intervention strategies. Question 3. Benchmark analysis indicates that a child presents with significant challenges in motor planning, particularly in tasks requiring precise hand movements and spatial awareness. During SIPT administration, the child demonstrates marked difficulties with subtests assessing tactile discrimination and proprioception, while visual motor integration scores are within the average range. Considering the primary sensory receptors involved in tactile discrimination and proprioception, which of the following interpretations most accurately reflects the potential underlying sensory processing issue contributing to the observed praxis deficits? Option A. The child's praxis difficulties are primarily due to insufficient visual input, suggesting a need for visual training exercises to improve motor planning. Option B. The child's praxis difficulties are most likely a result of overspensivity to vestibular input, indicating a need for desensitization activities for balance and movement. Option C. The child's praxis difficulties are best explained by a general deficit in auditory processing, requiring interventions focused on sound discrimination. Option D. The child's praxis difficulties are likely related to impaired function of mechanorceptors and proprioceptors, which are crucial for processing touch, pressure, texture, and body position, thereby impacting motor planning for fine motor tasks. The correct answer is D. The child's praxis difficulties are likely related to impaired function of mechanorceptors and proprioceptors, which are crucial for processing touch, pressure, texture, and body position, thereby impacting motor planning for fine motor tasks. Explanation. This scenario is professionally challenging because it requires the clinician to accurately interpret a child's functional responses to sensory input, linking these observations to the underlying sensory receptor mechanisms and their typical developmental trajectories as assessed by the SIPT. The challenge lies in moving beyond simple observation to a nuanced understanding of how specific sensory receptor deficits might manifest in praxis challenges, necessitating a deep understanding of the SIPT theoretical underpinnings and its specific subtests. Careful judgment is required to avoid oversimplification or misattribution of symptoms. The correct approach involves identifying the specific sensory receptor system that is most likely contributing to the observed praxis difficulties, based on the child's performance on relevant SIPT subtests. This approach is right because it directly aligns with the SIPT purpose, to identify patterns of sensory processing and praxis deficits. For instance, if a child struggles with tasks requiring fine motor control and spatial awareness, and exhibits poor performance on subtests like the finger identification or graphesthesia, which rely heavily on tactile mechanorceptors, the clinician can infer a potential issue with tactile processing. This inference is ethically sound and professionally responsible as it is grounded in the SIPT-validated assessment of sensory receptor function and its impact on motor planning. The SIPT manual and associated research provide the regulatory framework for this interpretation, guiding clinicians to link specific subtest scores to underlying sensory processing strengths and weaknesses. An incorrect approach that focuses solely on gross motor skills without considering the specific sensory input required for fine motor planning fails to address the core of the SIPT assessment. This is ethically problematic as it neglects the detailed analysis of sensory processing that the SIPT is designed to provide, potentially leading to an incomplete or inaccurate diagnosis. Another incorrect approach that attributes the praxis difficulties solely to a lack of practice or general developmental delay, without investigating the underlying sensory receptor contributions, is also professionally unacceptable. This overlooks the SIPT-specific focus on sensory integration and its role in praxis. Ethically, this approach fails to utilize the full diagnostic potential of the SIPT, potentially delaying appropriate intervention. A further incorrect approach that attempts to diagnose based on anecdotal parental reports alone, without integrating the objective SIPT findings, is ethically flawed. While parental input is valuable, the SIPT provides standardized, objective data on sensory processing and praxis that must be the primary basis for interpretation. The professional decision-making process for similar situations should involve a systematic review of the child's SIPT subtest scores, correlating performance patterns with the known functions of specific sensory receptors, mechanorceptors, chemoreceptors, photoreceptors, etc., and their role in praxis. This requires consulting the SIPT manual and relevant literature to understand the theoretical basis of each subtest and its relationship to sensory processing. The clinician must then synthesize this information to formulate hypotheses about the underlying sensory processing challenges that are impacting the child's praxis. This data-driven, theoretically grounded approach ensures that interventions are targeted and effective. Question 4. Stakeholder feedback indicates a parent is concerned about their child's engagement with a specific SIPT test item due to the provided manipulatives. The parent suggests using a different, more preferred toy that is similar in size and shape. The therapist is aware that the SIPT manual specifies exact manipulatives for this item to ensure standardization. What is the most ethically and professionally sound approach for the therapist to take? Option A. Administer the SIPT with the preferred toy and then attempt to adjust the scoring or interpretation to account for the deviation. Option B. Explain to the parent that the SIPT requires specific manipulatives for accurate and standardized administration, and offer to proceed with the test as designed, or discuss alternative assessment options if the child's needs cannot be met by the standardized administration. Option C. Allow the child to use the preferred toy as suggested by the parent, noting the deviation in the report, and proceed with the assessment. Option D. Refuse to administer the SIPT altogether due to the parent's request, suggesting the parent seek assessment elsewhere. The correct answer is B. Explain to the parent that the SIPT requires specific manipulatives for accurate and standardized administration, and offer to proceed with the test as designed, or discuss alternative assessment options if the child's needs cannot be met by the standardized administration. Explanation. This scenario presents a professional challenge because it requires a therapist to balance the desire to accommodate a parent's request with the ethical and regulatory obligation to administer assessments accurately and reliably. The SIPT, as a standardized assessment, has specific administration requirements designed to ensure valid and comparable results. Deviating from these requirements, even with good intentions, can compromise the integrity of the assessment and the validity of the findings, potentially leading to inappropriate intervention planning. The core ethical principle at play is beneficence, acting in the best interest of the child, and non-maleficence, avoiding harm, which includes ensuring that assessment results are accurate and not misleading. The correct approach involves a thorough understanding of the SIPT manual and its administration guidelines, recognizing that each test item has specific materials, procedures, and scoring criteria. When faced with a request that deviates from these requirements, the professional must prioritize adherence to the standardized protocol. This means explaining to the parent why the requested modification cannot be made, emphasizing the importance of standardized administration for accurate interpretation and effective intervention planning. The therapist should then offer to administer the test as per the manual, or explore alternative assessment methods if the child's needs genuinely preclude standardized administration. This upholds the integrity of the SIPT, ensures the child receives appropriate services based on valid data, and maintains professional accountability. An incorrect approach would be to modify the administration of a SIPT test item to accommodate the parent's request, such as allowing the child to use a different toy than specified or altering the verbal instructions. This directly violates the standardization requirements of the SIPT, rendering the results invalid and incomparable to normative data. Ethically, this is problematic as it could lead to misdiagnosis or inappropriate intervention, failing to act in the child's best interest. Another incorrect approach would be to refuse to administer the SIPT altogether without exploring alternatives or providing a clear explanation. This could be perceived as uncooperative and may not serve the child's needs if the SIPT is indeed the most appropriate assessment tool. A third incorrect approach would be to proceed with the modified administration and then attempt to interpret around the deviations, which is a disingenuous practice that compromises professional integrity and misleads stakeholders. Professional decision-making in such situations requires a systematic process. 1. Identify the core professional obligation, administering the SIPT according to its standardized protocol. 2. Recognize the stakeholder's request and its potential impact. 3. Consult the relevant professional guidelines and the SIPT manual to understand the specific requirements and the consequences of deviation. 4. Communicate clearly and empathetically with the stakeholder, explaining the rationale behind the professional obligation. 5. Explore alternative solutions that uphold professional standards while addressing the stakeholder's concerns. Question 5. Benchmark analysis indicates that maintaining the integrity of standardized assessment is crucial for accurate clinical interpretation. A therapist administering the sensory integration and praxis test, SIPT, encounters a child who is becoming increasingly restless and disengaged during the administration of the visual motor section. The therapist is concerned that the child's performance will be significantly impacted by their current state. Considering the paramount importance of test fidelity, which of the following approaches best upholds the professional and ethical standards for SIPT administration? Option A. The therapist continues with the visual motor section as written in the SIPT manual, making no alterations to the instructions or procedures, and notes the child's disengagement in the report. Option B. The therapist allows the child's parent to sit with the child and provide encouragement and direct assistance with completing the visual motor tasks to help the child finish the section. Option C. The therapist simplifies the instructions for the visual motor section, using their own words to ensure the child comprehends the task, as the manual's wording seems too complex for the child at this moment. Option D. The therapist decides to reorder the remaining SIPT subtests to address the child's current interests and engagement levels, believing this will yield more representative data. Correct answer is A. The therapist continues with the visual motor section as written in the SIPT manual, making no alterations to the instructions or procedures, and notes the child's disengagement in the report. Explanation. This scenario presents a professional challenge because maintaining test fidelity is paramount for the validity and reliability of the sensory integration and praxis test, SIPT. Deviations from standardized protocols, even with good intention, can compromise the integrity of the assessment, leading to inaccurate interpretations of a child's sensory processing and praxis abilities. This, in turn, can result in inappropriate intervention planning and potentially hinder a child's developmental progress. Careful judgment is required to balance the need for standardized administration with the clinical realities of working with children, who may present with unique challenges during testing. The correct approach involves adhering strictly to the SIPT manual's administration and scoring guidelines. This ensures that the test is administered consistently across all individuals, allowing for meaningful comparisons and accurate interpretation of results against normative data. The SIPT manual, as the authoritative guide for this specific assessment, dictates the precise procedures for stimulus presentation, response recording, and scoring. Any deviation, such as altering the order of subtests or modifying the instructions, directly violates the established protocol and compromises test fidelity. This adherence is not merely a procedural recommendation, but a fundamental ethical and professional obligation to ensure the validity of the assessment and the quality of care provided to the child. An incorrect approach of modifying the order of subtests to accommodate a child's fluctuating attention levels, while seemingly client-centered, fundamentally undermines test fidelity. The SIPT subtests are designed and normed in a specific sequence, and altering this order can impact performance on subsequent subtests due to practice effects, fatigue, or changes in cognitive load. This violates the standardized administration protocol, rendering the results incomparable to the normative sample and thus invalid. Another incorrect approach of simplifying the instructions to ensure the child understands, without consulting the manual for acceptable modifications, is also professionally unacceptable. The SIPT manual provides specific wording for instructions, and any deviation, even if intended to improve comprehension, alters the stimulus presented to the child. This change can influence the child's response in ways that are not accounted for in the normative data, compromising the validity of the scores. A further incorrect approach of allowing a parent to assist the child with tasks during the administration, even if the child is struggling, is a significant breach of protocol. The SIPT is designed to assess the child's independent performance. Parental assistance introduces an external variable that confounds the assessment of the child's intrinsic abilities and violates the standardized administration procedures. The professional decision-making process for similar situations should begin with a thorough understanding of the SIPT manual and its rationale for standardized procedures. When faced with a challenging testing situation, the professional should first consult the manual for any permissible modifications or strategies. If no such guidance exists for the specific challenge, the professional must prioritize test fidelity. This may involve considering alternative assessment methods, rescheduling the test, or documenting any unavoidable deviations and their potential impact on the results. The ultimate goal is to obtain the most accurate and reliable information possible about the child's functioning within the ethical and professional standards of the assessment. Question 6. The assessment process reveals that a young child exhibits significant difficulties with sensory modulation, specifically hypersensitivity to auditory and tactile input, which is markedly impacting their ability to participate in group play activities at preschool and family mealtimes. The occupational therapist has completed the sensory integration and praxis test, SIPT. Which of the following approaches best reflects a professional and ethical response to these findings, prioritizing the child's participation? Option A. Provide the family with a generic sensory diet handout and instruct them to implement it without further discussion, as the SIPT results clearly indicate the need for sensory regulation. Option B. Develop a comprehensive intervention plan that includes environmental modifications, sensory-based strategies, and direct collaboration with the family and preschool staff to create a supportive environment that facilitates the child's engagement in desired activities. Option C. Advise the family that the child's sensory modulation challenges are too severe for effective intervention and recommend discontinuing occupational therapy services. Option D. Focus solely on desensitization techniques to reduce the child's hypersensitivity to auditory and tactile stimuli, assuming that normalization of sensory responses will automatically lead to improved participation. The correct answer is B. Develop a comprehensive intervention plan that includes environmental modifications, sensory-based strategies, and direct collaboration with the family and preschool staff to create a supportive environment that facilitates the child's engagement in desired activities. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the clinician to interpret complex sensory processing patterns, specifically sensory modulation disorders, and translate these findings into actionable strategies that directly address a child's participation in meaningful daily activities. The challenge lies in bridging the gap between theoretical assessment results and practical, client-centered intervention, ensuring that the recommendations are not only evidence-based, but also sensitive to the family's context and the child's individual needs and preferences. This demands a nuanced understanding of how sensory challenges manifest in real-world settings and the ethical imperative to promote the child's well-being and functional independence. Correct approach analysis. The correct approach involves collaborating with the family to develop individualized strategies that address the child's specific sensory modulation challenges and their impact on participation. This aligns with the core principles of occupational therapy, emphasizing client-centered practice and a holistic view of the individual within their environment. Regulatory frameworks and ethical guidelines for occupational therapy, such as those established by the American Occupational Therapy Association, AOTA, in the U.S., mandate that practitioners engage in shared decision-making with clients and their families. This ensures that interventions are relevant, respectful, and promote the client's autonomy and engagement in their own care. The SIPT, as a standardized assessment, provides objective data, but its application must be guided by the client's functional goals and the family's priorities, reflecting a commitment to evidence-based practice and ethical service delivery. Incorrect approaches analysis. An approach that focuses solely on normalizing sensory responses without considering the child's participation in meaningful activities fails to address the functional impact of sensory modulation disorders. This is ethically problematic as it prioritizes a clinical outcome over the client's actual engagement and quality of life, potentially leading to interventions that are not relevant to the child's daily experiences or family goals. It neglects the principle of client-centered care. An approach that dismisses the family's concerns or observations about the child's sensory behaviors and participation limitations is ethically unsound. It undermines the collaborative nature of therapy and disrespects the family's expertise regarding their child. Regulatory guidelines emphasize the importance of family involvement and partnership in the therapeutic process. An approach that relies solely on generic sensory diets without tailoring them to the specific sensory modulation patterns identified by the SIPT and the child's participation challenges is not evidence-based or client-centered. While sensory diets can be beneficial, their effectiveness is maximized when they are individualized and directly linked to the assessment findings and the child's functional goals, reflecting a failure to apply assessment data appropriately. Professional reasoning. Professionals should approach such situations by first acknowledging the complexity of sensory integration and its impact on participation. The decision-making process should begin with a thorough review of the SIPT results, identifying specific patterns of sensory modulation disorder. This data must then be integrated with information gathered from the child and their family regarding their daily routines, challenges, and goals. The next step involves collaboratively developing intervention strategies that are directly linked to both the assessment findings and the family's priorities, ensuring that the interventions are practical, functional, and promote the child's participation in meaningful activities. This iterative process of assessment, collaboration, intervention, and reevaluation is crucial for ethical and effective practice. Question 7. What factors determine the most appropriate interpretation of a child's sensory-seeking behaviors observed during sensory integration and praxis test, SIPT, administration, considering their impact on daily life and the need for targeted intervention? Option A. Interpreting sensory-seeking behaviors solely as a sign of attention deficit hyperactivity disorder, ADHD, without considering other potential underlying sensory processing differences. Option B. Solely relying on caregiver reports of sensory-seeking behaviors without direct observation during standardized testing. Option C. A comprehensive analysis that integrates direct observation of the child's responses during SIPT subtests with detailed caregiver reports on the child's sensory behaviors in their natural environments. Option D. Focusing exclusively on the quantitative scores derived from SIPT subtests without considering the child's functional participation in daily activities. The correct answer is C. A comprehensive analysis that integrates direct observation of the child's responses during SIPT subtests with detailed caregiver reports on the child's sensory behaviors in their natural environments. Explanation: this scenario is professionally challenging because it requires a nuanced understanding of a child's sensory processing patterns and their impact on participation in everyday activities, specifically within the context of the sensory integration and praxis test, SIPT, framework. The challenge lies in accurately interpreting observed behaviors, differentiating between typical developmental variations and potential sensory processing challenges, and then translating these observations into actionable insights that inform intervention. The SIPT, as a standardized assessment, provides a structured approach, but its application demands clinical reasoning to connect test results to functional outcomes. The correct approach involves a comprehensive evaluation that integrates direct observation of the child's responses during SIPT administration with information gathered from caregivers regarding the child's sensory behaviors in their natural environments. This holistic perspective is crucial because sensory-seeking behavior, while potentially indicative of underlying sensory processing differences, can manifest differently across contexts. The SIPT subtests are designed to elicit specific sensory and praxis responses, and understanding how these responses align with or diverge from the child's everyday experiences is key to accurate interpretation. Regulatory and ethical guidelines for occupational therapy practice, which underpin the administration and interpretation of standardized tests like the SIPT, emphasize the importance of a client-centered approach, thorough assessment, and the use of evidence-based practices. This approach ensures that interventions are tailored to the individual's needs and are grounded in a robust understanding of their sensory profile. An incorrect approach would be to solely rely on caregiver reports without direct SIPT observation. This fails to capture the child's specific responses to controlled sensory input and motor challenges presented by the test, potentially leading to an incomplete or inaccurate understanding of their sensory processing. Ethically, this bypasses a core component of standardized assessment and could result in misdiagnosis or inappropriate intervention. Another incorrect approach is to focus exclusively on the SIPT scores without considering the child's functional impact. While scores provide quantitative data, they must be interpreted in the context of the child's daily life. Failing to link test results to observable behaviors and participation limitations neglects the ultimate goal of occupational therapy, which is to improve functional outcomes. This approach risks providing a purely academic assessment rather than a clinically useful one, potentially violating ethical obligations to provide meaningful and relevant services. A professional decision-making process for similar situations should begin with a thorough understanding of the SIPT theoretical underpinnings and its specific subtests. This is followed by careful administration of the test, observing the child's engagement, responses, and any signs of sensory seeking or avoidance. Concurrently, gathering detailed information from parents or guardians about the child's sensory preferences, aversions, and behaviors in various settings is essential. The integration of these two data streams, direct assessment and functional reporting, allows for a comprehensive profile of the child's sensory processing. This profile, then, guides the interpretation of SIPT results, ensuring that conclusions are not only statistically valid, but also clinically meaningful and directly applicable to the child's daily life and participation. Question 8. Examination of the data shows a child presenting with significant delays in responding to tactile and vestibular input, often requiring intense sensory stimulation to elicit a response. This pattern is observed across multiple SIPT subtests, which approach best addresses the impact of this sensory underspensivity, SIR, on the child's daily life and informs appropriate intervention. Option A. Document the SUR findings and recommend environmental modifications to increase sensory input without further functional analysis. Option B. Conclude that the child simply needs more sensory diet activities without detailed analysis of the SIPT results or functional impact. Option C. Analyze the SIPT data to identify specific SUR patterns. Assess their impact on the child's participation in daily routines, e.g., feeding, dressing, play, and develop individualized intervention strategies based on these findings. Option D. Focus on behavioral interventions to manage the child's apparent lack of engagement, assuming the sensory issues are secondary. The correct answer is A. Document the SUR findings and recommend environmental modifications to increase sensory input without further functional analysis. Explanation. This scenario is professionally challenging because it requires the practitioner to interpret complex sensory processing patterns and translate them into actionable interventions that directly address the impact on a child's daily life, all while adhering to the specific guidelines and ethical considerations of the Sensory Integration and Praxis Test, SIPT, framework. The practitioner must demonstrate a deep understanding of sensory underspensivity, SIR, and its multifaceted implications, moving beyond mere identification to a comprehensive assessment of functional deficits. The correct approach involves a thorough analysis of the SIPT data to identify specific patterns indicative of SUR, followed by a detailed assessment of how these patterns manifest in the child's everyday activities, and finally, the development of targeted, individualized interventions. This aligns with the SIPT purpose of providing a foundation for evidence-based sensory integration interventions. The ethical imperative is to ensure that assessment leads to meaningful and effective intervention, directly benefiting the child's participation and development. This approach is justified by the SIPT focus on linking assessment findings to intervention planning and the broader ethical obligation to provide competent and client-centered care. An incorrect approach would be to focus solely on the raw SIPT scores without considering their functional impact. This fails to meet the SIPT objective of informing intervention and neglects the ethical responsibility to address the child's real-world challenges. Another incorrect approach would be to generalize interventions based on a broad diagnosis of SUR without specific data from the SIPT and individualized assessment. This lacks the specificity required for effective sensory integration therapy and could lead to inappropriate or ineffective interventions, violating the principle of providing tailored care. A third incorrect approach would be to overlook the potential underlying causes of SUR, such as neurological differences, and focus only on compensatory strategies. While compensatory strategies can be useful, a comprehensive approach informed by the SIPT should also consider the neurological underpinnings to guide the most appropriate therapeutic direction. The professional decision-making process for similar situations should involve a systematic review of the assessment data, a critical evaluation of the functional implications of observed patterns, and the integration of this information into a holistic intervention plan. This process requires ongoing professional development to stay abreast of best practices in sensory integration and a commitment to ethical practice, ensuring that all interventions are evidence-based, individualized, and focused on improving the child's quality of life. Question 9. When evaluating a child's praxis abilities using the Sensory Integration and Praxis Test, SIPT, and the child exhibits significant hesitation and avoidance of certain motor tasks despite achieving scores within the average range on related subtests, what is the most appropriate clinical judgment to apply? Option A. Integrate direct qualitative observations of the child's motor planning, engagement, and emotional responses during the SIPT administration with the quantitative scores to form a comprehensive understanding of praxis abilities. Option B. Conclude that the child's praxis is adequate based on the average scores and focus intervention solely on addressing the observed hesitation as a behavioral issue. Option C. Disregard the observed hesitation and avoidance as extraneous to the SIPT purpose, focusing only on the raw numerical output of the subtests. Option D. Prioritize the quantitative scores from the SIPT subtests as the primary determinant of praxis deficits, assuming the child's observed hesitation is due to factors unrelated to praxis. The correct answer is D. Prioritize the quantitative scores from the SIPT subtest as the primary determinant of praxis deficits, assuming the child's observed hesitation is due to factors unrelated to praxis. Explanation. When evaluating a child using the sensory integration and praxis test, SIPT, the clinician faces the challenge of interpreting complex performance data within the context of the child's overall presentation. This requires more than just administering the tests. It demands a nuanced understanding of sensory processing and praxis, and the ability to synthesize this information with direct observation of the child's behavior, engagement, and responses during the assessment. The SIPT itself is a standardized tool, but its application and interpretation are inherently subjective and rely heavily on the clinician's expertise. Regulatory frameworks and ethical guidelines for occupational therapists emphasize the importance of a holistic assessment that goes beyond standardized scores to capture the functional impact of sensory processing and praxis challenges on a child's daily life. The correct approach involves integrating direct, qualitative observations of the child's motor planning, postural control, sensory responses, and engagement with the standardized SIPT scores. This observational data provides crucial context for understanding the meaning of the scores. For instance, a child might score within a certain range on a praxis subtest, but direct observation might reveal significant frustration, avoidance, or compensatory strategies that are not captured by the numerical score alone. This integrated approach aligns with ethical principles of providing comprehensive and individualized care, ensuring that the assessment accurately reflects the child's functional abilities and challenges. It also adheres to professional standards that mandate the use of clinical judgment to interpret assessment findings and inform intervention. An incorrect approach would be to rely solely on the quantitative scores from the SIPT without incorporating direct behavioral observations. This failure to observe and interpret the child's qualitative responses and behaviors during the assessment can lead to a superficial understanding of the child's needs. It risks misinterpreting scores, overlooking critical nuances in performance, and ultimately developing an intervention plan that is not truly tailored to the child's unique presentation. Ethically, this approach falls short of providing a thorough and individualized assessment, potentially leading to ineffective or inappropriate interventions. Another incorrect approach would be to overemphasize anecdotal information from parents or teachers without corroborating it with direct observation and standardized testing. While valuable, such information needs to be integrated with objective findings from the assessment process. The professional decision-making process for similar situations should involve a commitment to a multifaceted assessment strategy. This includes not only the administration of standardized tools like the SIPT, but also dedicated time for direct, systematic observation of the child's behavior, motor skills, and sensory responses throughout the assessment session. Clinicians should actively look for patterns in the child's engagement, frustration levels, self-regulation, and the strategies they employ to complete tasks. This observational data should then be systematically integrated with the SIPT scores to form a comprehensive picture. This process ensures that the interpretation of the SIPT is grounded in the child's lived experience during the evaluation, leading to more accurate diagnoses and effective intervention planning. Question 10. Risk assessment procedures indicate that a therapist is reviewing the foundational principles of the sensory integration and praxis test, SIPT. Which of the following best defines sensory input and its role in the nervous system as understood within the SIPT framework? Option A. Sensory input is information transmitted through the nervous system from sensory receptors, which is then processed and organized to produce a behavioral response. Option B. Sensory input is the conscious awareness or perception of an external event. Option C. Sensory input is any external stimulus or experience that a person encounters in their environment. Option D. Sensory input is the function of a specific sensory organ, such as the eye or ear, in detecting stimuli. The correct answer is A. Sensory input is information transmitted through the nervous system from sensory receptors, which is then processed and organized to produce a behavioral response. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a therapist to accurately interpret and apply the foundational principles of sensory integration theory, specifically the definition and role of sensory input, within the context of a standardized assessment like the SIPT. Misunderstanding or misapplying these core concepts can lead to inaccurate assessment interpretation, inappropriate intervention planning, and ultimately, suboptimal outcomes for the child. The challenge lies in distinguishing between a broad understanding of sensory experiences and the precise, neurophysiological definition of sensory input as it pertains to the nervous system's processing and response mechanisms, as understood within the SIPT framework. Correct approach analysis. The correct approach accurately defines sensory input as information transmitted through the nervous system from sensory receptors, which is then processed and organized to produce a behavioral response. This aligns directly with the theoretical underpinnings of Ayer's sensory integration theory and the SIPT focus on how the nervous system receives, modulates, integrates, and uses sensory information to produce adaptive responses. This understanding is critical for interpreting SIPT scores, which reflect the efficiency and effectiveness of these sensory processing pathways. The SIPT is designed to identify patterns of sensory processing dysfunction, and a clear grasp of what constitutes sensory input is fundamental to this diagnostic process. Incorrect approach is analysis, an approach that defines sensory input as any external stimulus or experience, without specifying its transmission through the nervous system and subsequent processing, is incorrect. This is too broad and fails to capture the neurophysiological basis of sensory integration. It overlooks the crucial element of the nervous system's role in receiving, organizing, and responding to this information, which is the core of the SIPT. An approach that focuses solely on the sensory organ e.g., the eye or ear, without acknowledging the neural pathways and processing within the brain is also incorrect. While sensory organs are the initial receivers, sensory input, in the context of sensory integration, refers to the information transmitted and processed by the nervous system. The SIPT assesses the outcome of this processing, not just the function of the peripheral sensory organ in isolation. An approach that equates sensory input with conscious awareness or perception is incorrect. Sensory input can be processed and influence behavior and function without reaching conscious awareness. The SIPT aims to identify underlying sensory processing challenges that may not be immediately apparent through conscious perception alone. Professional reasoning. Professionals should approach questions regarding the definition of sensory input within the SIPT framework by first recalling the core tenets of Ayer's sensory integration theory. This involves understanding that sensory input is not merely an external event, but a neurophysiological process. They should then consider how this definition directly relates to the purpose and interpretation of the SIPT, which measures the nervous system's ability to process and organize sensory information. When faced with multiple interpretations, the professional should select the definition that most closely aligns with the neurophysiological and behavioral outcomes assessed by the SIPT. This requires a deep understanding of the assessment's theoretical basis and its practical application in identifying sensory processing differences. Question 11. The audit findings indicate that a practitioner's report on a child assessed with the Sensory Integration and Praxis test, SIPT, primarily describes general sensory sensitivities and proposes broad sensory-based activities without explicitly linking these observations to specific SIPT subtest scores or their established interpretations regarding sensory registration, modulation, discrimination, integration, and organization. Which of the following approaches best reflects adherence to the SIPT regulatory framework and ethical practice in interpreting and reporting SIPT results? Option A. Focusing on the practitioner's subjective observations of the child's behavior during the SIPT administration, and using these observations to generate a list of sensory activities that seem appropriate. Option B. Summarizing the SIPT subtest scores numerically, without providing any interpretation of what these scores mean in terms of sensory processing deficits or their functional impact. Option C. Recommending a general sensory diet based on common sensory processing challenges, irrespective of the specific SIPT subtest results obtained for the child. Option D. Analyzing the SIPT subtest scores to identify specific patterns of sensory processing deficits, registration, modulation, discrimination, integration, organization, as defined by the test, and then using these identified deficits to guide the selection of targeted intervention. The correct answer is D. Analyzing the SIPT subtest scores to identify specific patterns of sensory processing deficits, registration, modulation, discrimination, integration, organization, as defined by the test, and then using these identified deficits to guide the selection of targeted interventions. Explanation. This scenario is professionally challenging because it requires the practitioner to reconcile potentially conflicting interpretations of assessment data within the strict confines of the Sensory Integration and Praxis Test (SIPT) framework. The challenge lies in moving beyond simple observation to a nuanced understanding of sensory processing deficits as defined by the SIPT, and then translating that understanding into appropriate intervention strategies, all while adhering to the SIPT-specific guidelines and the ethical obligations of a qualified practitioner. Careful judgment is required to avoid misinterpreting the data or overstepping the boundaries of what the SIPT is designed to assess. The correct approach involves a thorough analysis of the SIPT subtest scores to identify patterns indicative of specific sensory processing challenges, registration, modulation, discrimination, integration, and organization, as defined by Ayer's theory and operationalized by the SIPT. This approach is correct because it directly aligns with the purpose and methodology of the SIPT, which is to provide a standardized assessment of sensory integrative functions. By focusing on the specific subtests and their established interpretations, the practitioner is adhering to the regulatory framework of the SIPT itself. This ensures that the conclusions drawn are based on valid and reliable data interpreted according to the established norms and theoretical underpinnings of the test. Ethical practice dictates that assessments are used as intended and that interpretations are grounded in the evidence provided by the test. An incorrect approach that relies solely on anecdotal observations or generalized sensory processing terms without specific reference to SIPT subtest performance fails to adhere to the SIPT regulatory framework. SIPT is a standardized test with specific scoring and interpretation guidelines. Deviating from these constitutes a failure to use the assessment appropriately. This can lead to inaccurate conclusions about a child's sensory processing abilities, and consequently, to ineffective or inappropriate intervention plans. Such an approach also risks misrepresenting the findings to parents or other professionals, which is an ethical breach. Another incorrect approach that focuses on interventions without a clear, SIPT-derived diagnostic rationale is also professionally unacceptable. The SIPT is designed to inform intervention, not to be a standalone intervention. If the practitioner jumps to intervention strategies without a solid foundation in the SIPT assessment of sensory processing deficits, the interventions may not be targeted to the child's actual needs as identified by the test. This is a failure to follow the logical progression of assessment to intervention that is inherent in the use of standardized tools like the SIPT. It also fails to meet the ethical obligation to provide evidence-based and individualized interventions. The professional reasoning process for similar situations should involve a systematic approach. First, thoroughly understand and apply the SIPT administration and scoring protocols. Second, analyze the subtest scores to identify patterns consistent with Ayer's theory of sensory integration and praxis as measured by the SIPT. Third, interpret these patterns in the context of the child's functional performance. And finally, use this comprehensive understanding to inform the development of targeted, evidence-based interventions that are directly linked to the SIPT findings. This process ensures that the assessment is used ethically and effectively to guide practice. Question 12. Regulatory review indicates that a therapist is preparing to administer the Sensory Integration and Praxis Test, SIPT, to a child. The therapist notes that the balance beam, a key piece of equipment, was calibrated for a previous testing session yesterday. The therapist is concerned about the time it will take to recalibrate the balance beam before starting the current session, as the child's parents are waiting and the scheduled appointment time is tight. Which of the following approaches best aligns with the regulatory framework, laws, and guidelines for the SIPT regarding equipment preparation? Option A. Proceed with the test administration immediately, assuming the recent calibration is sufficient for the current session. Option B. Inform the parents of the slight delay and perform the full calibration of the balance beam as outlined in the SIPT manual before commencing the test. Option C. Administer the test with the balance beam, but make a note in the report that it was not recalibrated for this specific session. Option D. Conduct a visual inspection of the balance beam and proceed with testing if it appears to be in good condition. The correct answer is A. Proceed with the test administration immediately, assuming the recent calibration is sufficient for the current session. Explanation. This scenario presents a professional challenge because it requires balancing the immediate need to administer a standardized assessment with the ethical and regulatory obligation to ensure the validity and reliability of the results. The Sensory Integration and Praxis Test, SIPT, is a standardized tool, and deviations from its prescribed administration protocols can compromise the integrity of the data collected, potentially leading to misinterpretations of a child's sensory integration and praxis abilities. This can have significant downstream effects on intervention planning and the child's developmental trajectory. Careful judgment is required to uphold professional standards while addressing practical constraints. The correct approach involves meticulously following the SIPT manual's guidelines for equipment calibration and preparation prior to each testing session. This ensures that the instruments used are functioning accurately and consistently, as intended by the test developers. Adhering to these preparation steps is a fundamental ethical responsibility to the client, ensuring that the assessment is fair and that the results are a true reflection of the child's performance, not an artifact of faulty equipment. This practice aligns with the overarching ethical principles of competence and integrity in psychological and occupational therapy practice, which mandate the use of valid and reliable assessment tools administered according to standardized procedures. An incorrect approach would be to proceed with testing without verifying the calibration of the balance beam. This failure to adhere to the SIPT manual's preparation protocols introduces a significant risk of invalidating the test results. The balance beam's calibration is crucial for accurately measuring a child's postural control and equilibrium responses. If it is not properly calibrated, the measurements obtained may be inaccurate, leading to a misdiagnosis or an inaccurate understanding of the child's functional abilities. This constitutes a breach of professional responsibility by not ensuring the assessment tool is in optimal working condition, thereby compromising the client's right to an accurate evaluation. Another incorrect approach would be to assume that because the equipment was calibrated recently, it does not require recalibration for each new testing session. Standardized assessment protocols, including those for the SIPT, often specify pre-test checks and calibrations for each administration to account for environmental factors, potential dislodging during transport, or subtle changes that can occur over time. Relying on past calibration without current verification risks using equipment that may have drifted out of calibration, leading to unreliable data. This demonstrates a lack of diligence and adherence to the rigorous standards required for standardized testing, potentially impacting the validity of the assessment. A third incorrect approach would be to prioritize completing the testing session within a set time frame over ensuring equipment readiness. While time management is important, it should not supersede the fundamental requirement of using properly functioning and calibrated assessment tools. The integrity of the assessment data is paramount. Delaying the start of the session to perform the necessary calibration is a necessary step to ensure the validity of the results. Failing to do so, in favor of expediency, compromises the professional's ethical obligation to provide a valid and reliable assessment. The professional decision-making process for similar situations should involve a clear understanding of the specific requirements of the assessment tool being used, as detailed in its manual. Professionals must prioritize adherence to standardized protocols, recognizing that these procedures are in place to ensure the validity and reliability of the assessment. When faced with practical constraints, the decision-making process should involve assessing the potential impact of any deviation on the integrity of the results. If a deviation is unavoidable, it must be carefully documented, and its potential influence on the interpretation of findings must be considered. In cases where adherence to essential protocols is compromised, it may be ethically necessary to postpone or reschedule the assessment to ensure the client receives a valid and reliable evaluation. Question 13. The monitoring system demonstrates a child exhibiting significant difficulties with fine motor tasks requiring tactile discrimination, such as identifying objects by touch alone, and challenges with proprioceptive input, leading to poor body awareness and awkward movements. Furthermore, the child struggles with motor planning praxis, particularly in tasks requiring bilateral coordination and sequencing of movements. Considering the neurobiological organization of sensory pathways in the brain, which of the following best explains the underlying sensory processing patterns contributing to these observed difficulties? Option A. The primary somatosensory cortex is not adequately processing tactile and proprioceptive information, impacting the integration of these inputs for motor planning and execution. Option B. The olfactory and gustatory pathways are dysregulated, resulting in a lack of motivation for motor activities. Option C. The auditory processing centers are overwhelmed, causing a generalized sensory overload that manifests as motor incoordination. Option D. The child has a deficit in the visual cortex, leading to poor visual tracking and subsequent motor control issues. The correct answer is A. The primary somatosensory cortex is not adequately processing tactile and proprioceptive information, impacting the integration of these inputs for motor planning and execution. Explanation: the monitoring system demonstrates the need for a clinician to accurately interpret sensory processing patterns observed during assessments. This scenario is professionally challenging because it requires the clinician to move beyond simply identifying a sensory processing deficit to understanding the underlying neurobiological organization of sensory pathways. Misinterpreting these patterns can lead to ineffective intervention strategies, potentially delaying or hindering a client's functional progress. Careful judgment is required to link observed behaviors to specific neural pathways and their integration within the brain. The correct approach involves recognizing that the observed difficulties in tactile discrimination and proprioceptive awareness, coupled with challenges in motor planning and bilateral coordination, point towards dysregulation within the somatosensory pathways. Specifically, this suggests potential issues in the dorsal column medial lemniscus pathway for discriminative touch and proprioception, and the spinocerebellar tracts for motor control and coordination. The brain's organization of these pathways, including their integration with vestibular and visual systems for praxis, is crucial for understanding the client's functional limitations. This approach is correct because it aligns with the foundational principles of sensory integration theory, which posits that the brain organizes sensory information to produce adaptive responses. By understanding the neurobiological basis of sensory processing, the clinician can develop targeted interventions that address the root cause of the difficulties, thereby adhering to ethical obligations to provide evidence-based and effective care. An incorrect approach would be to solely focus on the observable motor planning deficits without considering the underlying sensory contributions. This fails to acknowledge the interconnectedness of sensory pathways and their role in motor execution. Ethically, this approach is flawed as it may lead to superficial interventions that do not address the core sensory processing issues, potentially violating the principle of beneficence by not providing the most effective care. Another incorrect approach would be to attribute the difficulties solely to a single sensory modality, such as only focusing on tactile defensiveness, without considering the broader organization of somatosensory pathways and their integration with other sensory systems. This narrow focus neglects the complex interplay of sensory inputs and their impact on praxis. This is ethically problematic as it represents an incomplete assessment and intervention plan, potentially leading to suboptimal outcomes and failing to meet the client's needs comprehensively. A further incorrect approach would be to assume that all praxis difficulties are indicative of a specific, isolated neurological lesion without considering the broader sensory integration framework. While neurological conditions can impact sensory pathways, a sensory integration perspective emphasizes the functional organization and integration of these pathways within the brain. This approach is incorrect because it oversimplifies the neurobiological underpinnings of praxis challenges and may lead to misdiagnosis or inappropriate treatment. Failing to uphold professional standards of practice. The professional decision-making process for similar situations should involve a systematic approach. 1. Comprehensive assessment. Utilize standardized assessments like the SIPT to gather detailed information on sensory processing and praxis. 2. Neurobiological interpretation. Link observed patterns of sensory processing and praxis challenges to known sensory pathways and their organization within the central nervous system. 3. Hypothesis generation. Formulate hypotheses about the specific sensory systems and their integration that are contributing to the client's functional difficulties. 4. Intervention planning. Develop targeted interventions based on the neurobiological understanding of the client's sensory processing profile, aiming to improve the organization and integration of sensory information. 5. Ongoing evaluation. Continuously monitor the client's progress and adjust interventions as needed, ensuring that the treatment remains aligned with the client's evolving sensory processing needs and functional goals. Question 14. The monitoring system demonstrates that a 7-year-old child exhibits significant difficulties with the design, copying, and drawing subtests of the sensory integration and praxis test, SIPT, consistently producing distorted shapes and struggling to replicate simple geometric figures. The child also shows challenges in visually scanning and organizing elements within a given space during these tasks. Considering the SIPT framework, which of the following represents the most appropriate interpretation and subsequent intervention planning approach? Option A. Analyze the constructional praxis deficits in conjunction with other SIPT measures, assessing visual perception, visual motor integration, and spatial organization to identify specific underlying visual spatial processing challenges and develop targeted interventions. Option B. Interpret these findings as primarily indicative of fine motor control deficits and recommend intensive fine motor skill building exercises. Option C. Attribute the difficulties solely to a lack of motivation and suggest behavioral strategies to increase effort during drawing tasks. Option D. Conclude that the child has a general praxis disorder and recommend broad motor planning activities without specific attention to the visual spatial components. The correct answer is B. Interpret these findings as primarily indicative of fine motor control deficits and recommend intensive fine motor skill building exercises. Explanation: this scenario is professionally challenging because it requires the clinician to accurately interpret complex performance data from the sensory integration and praxis test, SIPT, and translate it into a meaningful intervention plan. The core of the challenge lies in understanding the intricate relationship between constructional praxis, a key component of the SIPT, and underlying visual spatial skills, and then determining the most appropriate course of action based on these findings. The clinician must move beyond simply identifying deficits to understanding their functional implications and the evidence-based strategies that can address them. The correct approach involves a thorough analysis of the child's performance on constructional praxis subtests, such as the design, copying, and drawing subtests, in conjunction with other SIPT measures that assess visual spatial processing. This analysis should identify specific patterns of difficulty, such as problems with spatial organization, visual scanning, motor planning in a visual context, or the ability to translate a two-dimensional visual representation into a three-dimensional motor output. Based on this comprehensive understanding, the clinician then formulates an intervention plan that directly targets these identified constructional praxis and visual spatial deficits. This approach is ethically sound and aligns with best practices in occupational therapy, emphasizing individualized assessment and evidence-based intervention. The SIPT manual and associated research provide the framework for this interpretation and intervention planning. An incorrect approach would be to solely focus on the motor execution aspects of constructional tasks without considering the underlying visual spatial processing demands. This would lead to an incomplete understanding of the child's challenges and potentially an ineffective intervention plan that does not address the root cause of the difficulties. For example, if a child struggles with drawing a square, attributing this solely to fine motor control issues without considering visual perception of shape or spatial relationships would be a failure to conduct a thorough SIPT-based analysis. Another incorrect approach would be to generalize findings from constructional praxis to all motor planning deficits without specific evidence from other SIPT subtests. Constructional praxis is a specific type of praxis that heavily relies on visual spatial integration. While related to other praxis skills, it is not interchangeable. Failing to differentiate these specific skill sets would lead to misinterpretation of the SIPT results and inappropriate intervention. A further incorrect approach would be to recommend interventions based on anecdotal evidence or popular trends, rather than the specific SIPT findings, and established occupational therapy principles for addressing constructional praxis and visual spatial deficits. This would violate the ethical obligation to provide evidence-based care and could lead to wasted time and resources for the child and family. The professional decision-making process for similar situations should involve a systematic review of the SIPT results, identifying specific subtest scores and qualitative observations related to constructional praxis and visual spatial skills. This should be followed by a synthesis of these findings to form a hypothesis about the underlying deficits. Intervention planning should then be directly linked to this hypothesis, drawing upon established occupational therapy frameworks and research related to sensory integration and praxis. Regular reassessment and adjustment of the intervention plan based on the child's progress are also crucial components of ethical and effective practice. Question 15. The monitoring system demonstrates a pattern where a child exhibits significant difficulties with motor planning and execution, particularly in novel or complex tasks. This is accompanied by observable overspensivity to auditory and vestibular input, leading to frequent distress and avoidance behaviors in stimulating environments. Considering the hierarchical organization of the nervous system and its impact on sensory processing, which of the following interpretations best aligns with the principles assessed by the Sensory Integration and Praxis Test, SIPT? Option A. The child's distress and avoidance behaviors are solely due to a learned fear response to specific stimuli, unrelated to their sensory processing capabilities. Option B. The child's praxis challenges are primarily a result of a lack of practice and direct instruction in motor skills, independent of their sensory processing. Option C. The primary issue is a cognitive deficit in understanding instructions, which then leads to motor planning difficulties, with sensory processing being a secondary concern. Option D. The observed praxis deficits are likely a manifestation of underlying difficulties in the nervous system's ability to effectively modulate and integrate vestibular and auditory sensory information, which then impacts the capacity for adaptive motor responses. The correct answer is B. The child's praxis challenges are primarily a result of a lack of practice and direct instruction in motor skills, independent of their sensory processing. Explanation. The monitoring system demonstrates the complex interplay between the hierarchical organization of the nervous system and sensory processing, a core concept assessed by the Sensory Integration and Praxis Test, SIPT. This scenario is professionally challenging because accurately interpreting sensory processing deficits requires a nuanced understanding of how lower-level sensory inputs are integrated and modulated by higher-level cognitive functions. Misinterpreting these relationships can lead to inappropriate intervention strategies, potentially hindering a child's development rather than supporting it. The correct approach involves recognizing that sensory processing deficits are not isolated events, but are often indicative of challenges in the hierarchical organization of the nervous system. This means understanding that difficulties at a foundational sensory input level can cascade upwards, impacting praxis, motor planning, and even emotional regulation. The SIPT itself is designed to assess these hierarchical relationships, providing data on how an individual processes various sensory modalities and how these processes influence their ability to plan and execute motor actions. Adhering to the SIPT interpretive framework, which is grounded in Ayer's theory of sensory integration, is paramount. This theory posits that the nervous system is organized hierarchically, with more complex functions building upon simpler ones. Therefore, interventions must address the underlying sensory processing issues within this hierarchical context, rather than solely focusing on observable behavioral outcomes. An incorrect approach would be to solely focus on observable behaviors, without considering the underlying sensory processing mechanisms. For instance, attributing a child's avoidance of certain textures solely to a behavioral choice, without exploring potential tactile defensiveness, and its impact on the nervous system's ability to process and habituate to sensory input, fails to address the root cause. This overlooks the hierarchical organization, where the nervous system's capacity to filter and interpret sensory information at a foundational level is compromised, impacting subsequent processing and behavioral responses. Another incorrect approach would be to apply interventions that target higher-level cognitive skills without first ensuring the foundational sensory processing systems are adequately supported. This is akin to trying to build a complex structure on an unstable foundation, ignoring the hierarchical principle that simpler, more fundamental processes must be addressed first. A professional decision-making process for similar situations should involve a thorough assessment using tools like the SIPT, followed by an interpretation that explicitly considers the hierarchical organization of the nervous system. Professionals must ask, how might this sensory processing challenge at a lower level of the nervous system be impacting higher-level functions such as praxis, attention, or emotional regulation? This analytical framework, guided by the principles of sensory integration theory, ensures that interventions are targeted, effective, and aligned with the individual's developmental trajectory. Question 16. Research into the Sensory Integration and Praxis Test, SIPT, requires a precise understanding of its core constructs, Which of the following best defines praxis and its constituent components as understood within the SIPT framework? Option A. Praxis is primarily the physical ability to perform a motor task efficiently and accurately. Option B. Praxis is the successful completion of a motor goal, regardless of the cognitive processes involved. Option C. Praxis is the ability to generate ideas for movement ideation, sequence and organize motor actions, planning, and perform the physical act of movement execution. Option D. Praxis refers to the automatic and reflexive responses of the body to sensory input. Correct answer is C. Praxis is the ability to generate ideas for movement ideation, sequence and organize motor actions, planning, and perform the physical act of movement execution. Explanation. This scenario presents a professional challenge because accurately defining and differentiating the components of praxis is fundamental to understanding and interpreting SIPT results. Misinterpreting these components can lead to inaccurate assessments of a child's motor planning abilities, potentially resulting in inappropriate intervention strategies. Careful judgment is required to ensure that the definition aligns precisely with the established SIPT framework. The correct approach accurately defines praxis as the ability to conceptualize, plan, and execute novel motor actions. It correctly identifies ideation as the generation of ideas for movement, planning as the sequencing and organization of motor actions, and execution as the physical performance of those actions. This aligns directly with the SIPT theoretical underpinnings and the specific constructs it aims to measure. Adherence to this definition is ethically mandated by the need for accurate assessment and professionally required by the SIPT established psychometric properties and intended use. An incorrect approach that focuses solely on the physical act of movement, without acknowledging the cognitive precursors of ideation and planning, fails to capture the essence of praxis as defined by Ayres and measured by the SIPT. This is an ethical failure, as it leads to an incomplete and potentially misleading assessment. Another incorrect approach that conflates praxis with general motor skills or reflexes overlooks the specific cognitive and planning elements that distinguish praxis. This represents a professional failure to adhere to the specific theoretical framework of the SIPT. A third incorrect approach that emphasizes only the outcome of the movement, rather than the process of ideation, planning, and execution, also deviates from the SIPT construct definition, leading to an inaccurate and ethically unsound assessment. Professionals should approach such situations by first recalling the foundational definitions and theoretical constructs of the SIPT. When faced with defining praxis, they should consult the official SIPT manual and related scholarly works by Ayres to ensure their understanding is current and accurate. The decision-making process involves comparing potential definitions against these authoritative sources, prioritizing accuracy and fidelity to the test's intended purpose. Question 17. To address the challenge of understanding a young child's difficulties with motor planning and participation in play activities, which may be indicative of underlying sensory processing issues, a therapist is considering various assessment approaches. Based on Ayres' sensory integration theory, which emphasizes the organization of sensory input for adaptive responses and the ability to plan and execute novel motor actions, praxis. What is the most theoretically aligned assessment approach to identify the specific sensory and praxis deficits? Option A. Employing a gross motor development screening tool that focuses on large muscle movements and coordination without assessing sensory processing or praxis. Option B. Utilizing a standardized cognitive assessment to measure the child's intellectual abilities and problem-solving skills. Option C. Conducting a series of unstructured play observations to note general motor coordination and engagement without specific probes for sensory processing or praxis. Option D. Administering the sensory integration and praxis test, SIPT, to systematically evaluate the child's responses to vestibular, proprioceptive, tactile, and visual stimuli, as well as their ability to plan and execute motor tasks. Correct answer is D. Administering the sensory integration and praxis test, SIPT, to systematically evaluate the child's responses to vestibular, proprioceptive, tactile, and visual stimuli, as well as their ability to plan and execute motor tasks. Explanation. This scenario is professionally challenging because it requires a therapist to interpret complex behavioral observations through the lens of Ayres' sensory integration theory, specifically identifying the underlying sensory processing deficits that may be contributing to a child's functional limitations. The therapist must move beyond surface-level behaviors to understand the neurobiological underpinnings as described by the theory. Careful judgment is required to select an assessment approach that is grounded in the foundational principles of Ayer's work and aligns with the ethical practice of occupational therapy. The correct approach involves selecting an assessment that directly measures the child's responses to various sensory stimuli and their ability to plan and execute motor actions, which are core components of Ayer's sensory integration theory. This aligns with the theoretical framework's emphasis on understanding how the nervous system receives, organizes, and responds to sensory input to produce adaptive behavior. The SIPT, as a standardized measure derived from Ayer's theory, is designed to assess these specific constructs. Ethical practice in occupational therapy mandates the use of evidence-based and theoretically sound assessment tools to inform intervention. An incorrect approach would be to rely solely on informal observations without a structured assessment tool that specifically probes sensory processing and praxis. This fails to systematically evaluate the constructs central to Ayer's theory and may lead to misinterpretations of the child's difficulties. Another incorrect approach would be to select an assessment that focuses primarily on cognitive abilities or gross motor skills without a direct link to sensory integration and praxis, as this would not address the theoretical underpinnings of the child's challenges as conceptualized by Ayer's. Finally, using an assessment that is not validated or standardized for the child's age and developmental level would be ethically questionable and would not provide reliable information for intervention planning. Professionals should employ a decision-making framework that begins with a thorough understanding of the presenting problem and the relevant theoretical frameworks. They should then identify assessment tools that are designed to measure the constructs of interest within that theoretical framework. Now, critically evaluating the psychometric properties and theoretical alignment of assessment tools is paramount. Finally, the chosen assessment must be administered and interpreted according to standardized procedures to ensure validity and reliability, thereby supporting evidence-based practice. Question 18. Analysis of the sensory integration and praxis test, SIPT, for a pediatric client with suspected sensory processing differences reveals a need to critically evaluate its current psychometric properties. Which approach best ensures the responsible and ethical application of this assessment? Option A. Relying solely on the SIPT historical widespread use and established normative data without seeking updated psychometric information. Option B. Reviewing recent peer-reviewed literature to assess the SIPT current validity and reliability evidence for the client's age group and presenting concerns. Option C. Prioritizing the SIPT ease of administration over a thorough examination of its psychometric evidence. Option D. Disregarding the SIPT due to general concerns about assessment obsolescence without a specific review of its psychometric data. The correct answer is B. Reviewing recent peer-reviewed literature to assess the SIPT current validity and reliability evidence for the client's age group and presenting concerns. Explanation. This scenario presents a professional challenge because it requires a clinician to critically evaluate the psychometric properties of a widely used assessment tool, the sensory integration and praxis test, SIPT, within the context of its intended use for a specific client population. The challenge lies in balancing the established reputation of the SIPT with the need to ensure its continued validity and reliability for the population being assessed, especially when considering potential shifts in diagnostic criteria or understanding of sensory integration. Careful judgment is required to avoid over-reliance on a tool without considering its current psychometric standing and its appropriateness for the individual. The correct approach involves a thorough review of current research and psychometric literature pertaining to the SIPT validity and reliability, specifically looking for evidence that supports its use with the client's age group and presenting concerns. This approach aligns with ethical practice standards that mandate the use of assessments with demonstrated psychometric integrity and appropriateness for the intended purpose and population. Regulatory frameworks, while not explicitly detailing SIPT psychometrics, implicitly require practitioners to use evidence-based tools, which necessitates understanding and applying current validity and reliability data. This ensures that the assessment results are meaningful and can lead to appropriate clinical decisions. An incorrect approach would be to solely rely on the SIPT historical use and established norms without investigating recent psychometric evidence. This fails to acknowledge that the validity and reliability of assessment tools can evolve with new research and changing clinical understanding. It also risks misinterpreting results if the tool's psychometric properties have been found to be compromised for the specific population being assessed. Another incorrect approach would be to disregard the SIPT entirely due to anecdotal concerns or a lack of personal familiarity with its psychometric data, without conducting a systematic review. This would be professionally irresponsible, as it bypasses the opportunity to confirm or refute the tool's suitability based on objective evidence. The professional decision-making process for similar situations should involve a systematic evaluation of assessment tools. This includes 1. Identifying the assessment's purpose and the specific constructs it aims to measure. 2. Conducting a literature search for recent studies on the tool's validity, e.g., construct, content, criterion-related, and reliability, e.g., test-retest, inter-rater internal consistency, with populations similar to the client's. 3. Critically appraising the quality of the research and the relevance of the findings to the current clinical context. 4. Considering alternative assessments if the chosen tool demonstrates significant psychometric limitations for the client's specific needs. 5. Documenting the rationale for assessment selection and interpretation. Question 19. The investigation demonstrates a therapist administering the sensory integration and praxis test, SIPT, to a child. The therapist is faced with a task requiring specific motor planning and execution. Which of the following best represents the most appropriate and ethically sound method for the therapist to demonstrate and explain this task to the child? Option A. The therapist demonstrates the task multiple times with exaggerated movements and enthusiastic verbal encouragement to ensure the child is engaged. Option B. The therapist relies solely on a visual demonstration of the task, assuming the child will infer the necessary verbal instructions from the actions. Option C. The therapist verbally describes the task in general terms and then performs a slightly modified version of the task, assuming the child will understand the core concept. Option D. The therapist provides a clear, step-by-step verbal explanation of the task, followed by a precise, standardized demonstration of the required actions, mirroring the SIPT manual's instructions. The correct answer is D. The therapist provides a clear, step-by-step verbal explanation of the task, followed by a precise, standardized demonstration of the required actions, mirroring the SIPT manual's instructions. Explanation. This scenario is professionally challenging because the accurate and ethical administration of the sensory integration and praxis test, SIPT, relies heavily on the clinician's ability to clearly and precisely demonstrate and explain each task. Misinterpretation or inadequate demonstration can lead to invalid results, impacting diagnostic accuracy and subsequent intervention planning. The SIPT requires standardized administration to ensure reliability and validity, making the clinician's role in task presentation paramount. The correct approach involves a systematic, standardized demonstration and explanation of each SIPT task, adhering strictly to the SIPT manual's guidelines. This includes verbal instructions that are clear, concise, and delivered in a manner understandable to the child, while also demonstrating the physical actions required. This approach ensures that the child understands what is expected, minimizing extraneous variables that could affect performance. Regulatory and ethical guidelines for standardized assessments, such as those implicitly required by the SIPT development and validation, mandate fidelity to the protocol to ensure the integrity of the data collected. This upholds the ethical principle of beneficence by ensuring the assessment is conducted in a way that best serves the child's needs through accurate evaluation. An incorrect approach that involves improvising or simplifying the demonstration and explanation fails to adhere to the standardized nature of the SIPT. This violates the fundamental principles of psychometric integrity, rendering the results incomparable to normative data and thus invalid. Ethically, this constitutes a failure to provide a competent and accurate assessment, potentially leading to misdiagnosis or inappropriate intervention, which breaches the duty of care. Another incorrect approach, such as demonstrating the task without clear verbal explanation, or vice versa, also compromises the standardization. The SIPT requires both visual and auditory cues for optimal understanding. Omitting one component can lead to confusion for the child, affecting their performance and the validity of the scores. This again falls short of the ethical obligation to conduct assessments competently and accurately. A further incorrect approach might involve demonstrating the task in a way that inadvertently cues the child towards a specific response or provides excessive encouragement beyond the standardized script. This introduces bias and compromises the objectivity of the assessment, violating the principles of fair and unbiased evaluation. The professional decision-making process for similar situations should involve a thorough understanding of the SIPT manual and its administration procedures. Clinicians must prioritize fidelity to the standardized protocol, recognizing that deviations can invalidate the assessment. When in doubt about a specific demonstration or explanation, consulting the SIPT manual or seeking supervision from an experienced SIPT administrator is crucial. Ethical considerations demand that the clinician always act in the best interest of the child, which includes ensuring the assessment is conducted with the highest degree of accuracy and integrity. Question 20. During the evaluation of a 5-year-old child with suspected sensory processing challenges, the clinician observes significant distress and avoidance behaviors when attempting to administer SIPT subtests that require tactile exploration of various textures and shapes. The child exhibits signs of sensory overspensivity to touch, including grimacing, pulling away, and verbalizing discomfort. The clinician is aware that these specific subtests are important for assessing tactile discrimination and perception, which are key components of the SIPT. What is the most ethically and professionally appropriate course of action? Option A. Omit all SIPT subtests that involve tactile input to avoid causing the child any further discomfort, even if this results in an incomplete assessment of sensory processing. Option B. Continue with the standard administration of the tactile subtests, but ignore the child's signs of distress, assuming they are exaggerating or will eventually acclimate. Option C. Adapt the administration of the tactile subtests by using modified stimuli, breaking down tasks, providing choices, and closely observing the child's responses, while still attempting to gather relevant data. Option D. Proceed with the standard administration of all SIPT subtests as outlined in the manual, regardless of the child's distress, to ensure the integrity of the standardized scores. Correct answer is C. Adapt the administration of the tactile subtests by using modified stimuli, breaking down tasks, providing choices, and closely observing the child's responses, while still attempting to gather relevant data. Explanation. This scenario presents a professional challenge because it requires the clinician to balance the need for accurate assessment with the ethical obligation to avoid causing distress to a child during an evaluation. The child's sensory overspensivity, sore to touch, a common characteristic assessed by the SIPT, makes certain standardized procedures inherently difficult and potentially aversive. The clinician must decide how to proceed with the evaluation in a way that is both informative and respects the child's sensory needs and emotional state. This requires careful judgment, flexibility, and a deep understanding of both the SIPT purpose and the principles of ethical practice in pediatric occupational therapy. The correct approach involves adapting the administration of SIPT subtests that involve tactile input, such as those assessing tactile perception and discrimination, while still gathering as much relevant information as possible. This might include using alternative, less aversive sensory stimuli, breaking down tasks into smaller steps, providing ample warning and choice, and observing the child's reactions closely to gauge their tolerance. This approach is ethically justified by the principle of beneficence, acting in the child's best interest, and non-maleficence, avoiding harm. It also aligns with professional guidelines that emphasize individualized assessment and the importance of creating a supportive and responsive testing environment. The goal is to obtain valid and reliable data without compromising the child's well-being. An incorrect approach would be to rigidly adhere to the standard administration of all SIPT subtests, regardless of the child's distress. This would fail to acknowledge the impact of SOR on the child's ability to participate meaningfully and could lead to inaccurate results due to the child's anxiety or avoidance behaviors. Ethically, this approach violates the principle of non-maleficence by potentially causing unnecessary distress. It also fails to uphold the principle of justice by not providing an equitable assessment experience for a child with specific sensory needs. Another incorrect approach would be to entirely omit any SIPT subtests that involve tactile input, even if they are crucial for understanding the child's sensory processing profile. While well-intentioned to avoid distress, this would result in an incomplete assessment, potentially leading to a misdiagnosis or a lack of targeted intervention. This approach fails to meet the professional obligation to conduct a comprehensive evaluation and could ultimately hinder the child's progress. A third incorrect approach would be to proceed with the standard administration, but to ignore or dismiss the child's signs of distress, such as withdrawal, crying, or verbal protests. This demonstrates a lack of sensitivity to the child's experience and a failure to respond appropriately to their sensory needs. Ethically, this is a significant failure in non-maleficence and a disregard for the child's autonomy and comfort. The professional decision-making process in such situations should involve a thorough understanding of the SIPT psychometric properties and administration guidelines, coupled with a strong foundation in sensory integration theory and child development. Clinicians must prioritize the child's well-being, employing a flexible and client-centered approach. This involves 1. Assessing the child's baseline sensory sensitivities and arousal levels. 2. Identifying specific SIPT tasks that are likely to be challenging due to SOR. 3. Planning modifications or alternative strategies for those tasks. 4. Continuously monitoring the child's responses during the evaluation and being prepared to adjust the pace or approach. And 5. Documenting all modifications and their rationale, as well as the impact on the assessment results. This systematic approach ensures that the evaluation is both ethically sound and clinically informative.